Welcome to your health education channel. Today's episode has gotten to do with showing to you the difference between Tylenol and Ibuprofen. Now, first of all, I want you to know that both Tylenol and Ibuprofen, they are an OTC drug. That means over-the-counter drug, meaning that you do not need any prescription to get from your doctor before you can buy them from the pharmacy. So that is the meaning of the OTC. Now, I need to also let you know that drugs come in the brand name and also in the generic name. For example, Tylenol is the brand name for this drug, and its generic is this called acetaminophen. Acetaminophen is the generic name for the Tylenol, which is the brand name. I also want you to know that Ibuprofen has brand names, two brand names. One of the brand names that Ibuprofen has is Advil. So Advil is the brand name for Ibuprofen, and this Ibuprofen is the generic. Also, it has Motrin IB as the brand name for Ibuprofen, which is the generic. For example, if you go to the store now and you said you want to buy Ibuprofen, and let's suppose they don't have the generic and they say, oh, we only have Advil, or they say we only have Motrin, they are saying the same thing. Why? Because the chemical in the Motrin is Ibuprofen, and the chemical in the Advil is also Ibuprofen. So we should not get any confusion in that. So it should be clear to us. Now, what's the difference between both of them? Well, the brand means that the manufacturer of the company that actually made this drug, they spent a lot of money on research and development and clinical trials before they can produce it out. And they have proprietary rights to sell it to the people. And the name that they give to it is called Tylenol, which means the selling name, the brand name, or the trade name. Now, what's the difference? The difference is price, that the cost of brand name is more than the cost of the generic. Why is it cost? I just explained it to you that they spend a lot of money in research and development to make the drug. And that was the reason why it's so expensive, and they have to recoup the money back. Now, how does it come with generic? Well, the company that made this one have patent right for maybe 17 years or maybe 20 years before any other company can duplicate it and made a generic out of it. That is just the difference. Now, the amount that they spend on it is enormous compared to somebody who just copy it and make a generic out of it. So that's just the difference between the brand name and the generic name. Now, can we say that the brand name is of high quality than the generic name? No. The brand name and the generic drug, they are both bioequivalent, meaning that they have the same therapeutic effect, the same pharmacological effect. There is no difference because they are all both bioequivalent. The chemical they use in the brand name, which is acetaminophen, is also the one they use in the generic, which is acetaminophen. So there is no difference. If you want to talk about difference, maybe because of the addictive they put in the drug, maybe to hold the drug together or to color the drug, maybe that might be the difference, and somebody may be allergic to that and not allergic to it in the brand, but maybe they allergic to it in the generic, or maybe they are allergic to it in the brand and they are not allergic to it in the generic. So that's just the difference, but they are all the same, of high quality. There is no difference between both of them. Next, what is Tylenol used for and what is Ibuprofen used for? Well, both of them are used for fever, headache, and pain relief. Both generic and brand, they are used for pain relief, headache, and fever. Then, what is the difference between Tylenol and ibuprofen if what they are used for is the same? Well, from the use of the medication, we come to understand that there is a difference. What do I mean? For example, in Tylenol, you can use Tylenol with empty stomach and take it with water. You will not have any problem with your stomach. But in the case of ibuprofen, you cannot just take it with empty stomach. Otherwise, you're going to have some problems. Why? Because ibuprofen belongs to a family of NSAID. NSAID meaning non-steroidal anti-inflammatory drug. So that means that it has anti-inflammatory property that actually affect the GI tract. What I mean by GI tract is gastrointestinal tract, that is our stomach. It affects the lining of the stomach, it erodes it and causes it to bleed. So in order to protect the lining of the gut or the lining of the stomach, you have to protect it by taking it with food or you take it with milk. You take ibuprofen with milk or you take it with food so that it will not cause bleeding in your stomach. Not anybody can use Tylenol and not everybody can use ibuprofen. Tylenol is contraindicated for somebody that has liver problem. For example, cirrhosis due to alcohol, those people that have that kind of problem or their liver is not functioning well, they have to abstain from Tylenol, or if they take it, they need to be taking it cautiously. They have to be very, very careful. So for that's why we say it's contraindicated for those with liver function problems. So also in the case of ibuprofen also need to be extremely very careful, because first of all it also causes bleeding, and people that have ulcer, it's not good for them. We can say it's contraindicated for them because it will exacerbate their condition and make them bleed more. And those people that have heartburn, it's not also good for them. Also, it's not good for people that have kidney problem. Why? Because this drug called ibuprofen, it inhibits, that is, it blocks certain chemical which we call prostaglandin from doing its job. Why? Because prostaglandin actually dilates the blood vessel and allow the blood to flow into the kidney. But if you take ibuprofen, definitely it's going to block this chemical that open the blood vessel, and blood will not be able, it's going to reduce blood flow into the kidney. So for that reason, somebody with kidney problem should not take it. Also, ibuprofen causes something called fluid retention, that is, it retains water. So if you take it too much, it can build up pressure and give or affect somebody who has blood pressure and increase your blood pressure level. So these are the side effects of this drug that one has to be extremely careful when you are taking them. So for ibuprofen, to go over it, for ibuprofen, if you have kidney problem, don't take it. If you have ulcer, be careful with it. If you have heartburn, you must be very, very careful. If you have high blood pressure, you have to be very careful. In the case of Tylenol, if you have liver function problem, you have to be very, very careful. The next question is, when do we take ibuprofen and when do we take Tylenol? Okay, if you have fever, ibuprofen is very, very good for fever, and Tylenol also is good for fever. Now, if you have headache, Tylenol is very good for headache. If you have menstrual cramp, ibuprofen is the drug of choice. It's very, very good for menstrual cramp or menstrual pain. Now, if you have excessive drinking and you have a hangover, actually ibuprofen is good for you, or naproxen also is good for you. Now, if you have sore muscle sore, actually ibuprofen is good for you. If you have osteoarthritis, that is arthritis of the bone, Tylenol is the drug of choice. It's very good for you. Now you have arthritis ibuprofen is good for you. If you have sinusitis, ibuprofen is good for you. If you have earache, ibuprofen is good for you. If you have toothache, especially if you have the gum swollen up, actually because of the property of the anti-inflammatory property of it will bring down the swelling and will give relief to the patient. So ibuprofen is good for toothache. How about blood thinner? You don't use either Tylenol, don't use ibuprofen. The only thing you can use is aspirin, the low dose, like 81 milligram, low dose. I like to make clarification on the name of Tylenol, the name that they call it in other countries. In America, we call it Tylenol, but in the other countries like in Europe or in some parts of Africa, they call it a different name. So Tylenol, as the brand name for acetaminophen here in America, is called Panadol as the brand name for paracetamol. So paracetamol is the generic name in Europe and some other African countries. And they also have in Europe, they also have, like in UK, they also have many other brand names for Panadol. One is called Disproy, one is called Headaches, and another one is called Medino. Those are the brand name, for paracetamol. So paracetamol is acetaminophen. It's like acetaminophen, which is generic name. So the brand name is Panadol or Dispro or Headaches or Medino. So that's what they call it in Europe, especially in UK and Africa or some part of African countries. So that's the point I just want to make to you so that you can get the clarification clear. Because when I say sometimes when you hear Tylenol, it might be strange to you because you are not familiar with it, because it's only in America that we use the name, and any other country that they exported this medication to, actually they know about Tylenol. So, but the equivalent name for Tylenol is Panadol, which is very common in Europe, especially in UK and some part of Africa, in some countries. And that's just the point I want to bring to your attention. So these are the points that we have for you to explain to you about the difference between Tylenol and ibuprofen, which belongs to the family of NSAID, which is non-steroidal anti-inflammatory. So we know that next time you visit your pharmacy, your community pharmacy, I know you'll be able to know the kind of medication you need to buy, either Tylenol or ibuprofen. And this information we are furnishing you with will actually guide you. So we hope to see you next time in our video. Take care now. Bye-bye.
Viewers, if you like the content of this video and want to see more videos like this, please subscribe to this channel. And don't forget to turn on your push notification. Don't forget to like this video and comment so I can get your feedback. Thank you for tuning in to the Health Education Channel.